one. Good morning, everyone. I'm Jennifer Johnson here with our fearless leader from Golisano Children's Hospital, our physician-in-chief, Dr. Patrick Brophy. Good morning to you.
Good morning. How are you today?
So we didn't want to, though, get too much into the fall without rewinding to the summer, because there was a really big announcement over the summer that we want to talk about today. University of Rochester has been designated an Intellectual and Developmental Disabilities Research Center, that's one mouthful, by the National Institute of Child Health and Human Development. A lot of people call it the IDDRC. For people unfamiliar, they might be hearing about this for the very first time. What does this involve, and why is this such a big deal for us here?
So, we have, for a long time, in particular, our Division of Behavioral Pediatrics has held 2 of the 3 major grants focusing on people with intellectual and developmental disabilities. So I call this kind of the triple crown of IDD, and we've had Dr. Susan Hyman, who's led her team in pediatrics with some really terrific young people who have now moved into some of those leadership roles for the LEND grant and the USED grant. And this year we were awarded, in conjunction with the Neurosciences Center, the IDDRC. And what that brings together is an integration of education, clinical therapy, and now a research arm for all of us focusing on people with IDD. And it's a huge deal because there are only 4 centers in the country that hold all 3.
Wow.
Those grants. Yeah. So it really sort of brought together a multidisciplinary team to bring this whole process to fruition. And so it's a combination across multiple areas at the U of R and URMC, and really it has been a collaborative effort. So given that designation now really makes us, and we have been before, but it really sort of entrenches our recognition as an international center for expertise on people with intellectual and developmental disabilities.
That's impressive. And it comes with some money too. I mean, it's not too shabby either, right?
It was a $6 million grant. And so that was a great way to start. And our focus now is to really integrating all those grants together. So there's a good interdisciplinary mix and a great leadership team to actually continue to build our IDD enterprise here. Rochester has amazing experts in intellectual and developmental disabilities. We have been a national and an international leader in many of these efforts. So having all 3 of these grants is really special, actually, and really does set us apart from the rest of the country.
So I want to know what it means for families. I mean, I know this talks about a lot of different leaders. You mentioned Dr. Hyman, who is so beloved by so many families who say, our family would be much worse off if it weren't for the expertise and care and compassion of Dr. Hyman. So for families who are very familiar with this work, what does this designation maybe mean for their care moving forward?
So being able to actually have integrated care, what it also means, though, having the IDDRC, is it allows us to actually look at and examine potential therapeutics to really start to identify some of the potential genetic causes of IDD. And it allows us to actually develop equipment and technology that is more friendly for individuals with IDD, like special MRI scanners, things along that line. So I think it really allows us to bridge not only our clinical and educational efforts and community-based efforts, but it also allows us to bring a research component into this field. And there are so many things that are rapidly changing with our understanding of brain development and how things move forward. And I think that this will give us an opportunity to really develop some potential therapeutics and really improve kids' lives, improve children's lives, and maximize the potential for everybody with IDD.
I see that puts a smile on your face, of course. That's really cool to be able to say. We should mention too that the opportunity to participate in clinical research will be offered to interested families via social media in the near future. So folks listening at home can be a part of this really exciting development.
Yeah.
All right, well, we got to run, I know, but again, IDDRC, a mouthful to a lot of people, so we appreciate you breaking it down and helping us understand what this all means, especially for our families who can hopefully celebrate some really exciting developments here. Thanks so much. I appreciate your time.
Thank you. Have a great day. We'll talk to you later.
All right.